When we tend to brush our teeth, we tend to only brush the teeth, okay? But we tend to miss by the gum line, and that's where the plaque will build up. So if you can angle the toothbrush like a 45-degree angle and get at that junction of the gums and the teeth.
My name is Dr.Njeri and welcome to my channel. My social media name is Ciiku or Soxxy, that's what most of you know me as. And I'm a mother. I have two children, a girl who's 5 and a boy who's 3. And the journey with just oral health, taking care of the teeth, has been very keen for us as we are taking care of our children. And it brought about this session with the person I'm about to talk to. So welcome, Dr. Njeri. You'll tell us about taking care of our children's teeth and just the whole journey of the teeth.
My name is Dr.Njeri Njoroge, and I've been practicing for almost 20 years. Wow. It's been a long time. And I too am a mother of 2, and I really love treating children. It brings me so much joy. And also because I've gone through this journey with my own children, so I'm able to help other parents as they go through this journey with their children.
So let's start from pregnancy. When I'm pregnant, is there anything that I can do to ensure that the teeth will come out later is healthy?
Actually, even if you're thinking about having children or you're pregnant, you do want to think about your nutrition, because it's very important. Because as a mother, you know that the nutrition you're taking that's the nutrition the child will get. And also a very important thing that a lot of us forget about is vitamin D, the sunshine vitamin. So make sure you're getting a lot of sunshine, get a lot of vitamin D, because that's very important for healthy teeth and healthy bones.
Oh, okay.
Yes.
So when I'm pregnant, anything I eat, anything related to the teeth growing, because what I've learned from you is the teeth starts growing way before we see it.
Yes, so actually the teeth start developing 6 weeks in utero, that early. So yes, so even also antibiotics may be an issue. So if you need to take an antibiotic you really want to avoid taking is tetracycline, because that will stain now the baby's developing teeth, because remember they start as early as 6 weeks in utero.
Okay. No wonder even the calcium supplements, right?
So also your doctor may put you on calcium supplements. Make sure you know your phosphorus is good, that your vitamin D. These are very important things to make sure.
Okay, so now the baby has landed.
So the baby is here now, and I really encourage my mothers to breastfeed. We all know the importance of breast milk. It's the best food for the baby. But also, a lot of us don't know that it actually helps develop the mouth, the jaw. Because what's happening is the child is as they breastfeed, they're actually working their muscles, because they have to suck hard. Yes, they have to suck really hard to get the milk out. And so that's working the muscles, which now help develop the shape of the jaw. Whereas a bottle, because the child doesn't have to work as hard, it's easier for them to get that milk. So the jaw is not as well developed as if they're breastfeeding. So I encourage that if you can breastfeed as long as possible, because I do understand that a lot of mothers are working or they're not able to breastfeed, but that is the best thing.
Wow, I didn't even know that part of the suckling helps the jaw.
Yes, it does help develop the jaw.
Okay, let's wean this baby, or let's go to 6 months. When should I expect the first tooth to come out? What kind of food should I give during weaning? So
usually we expect the first tooth around 6 months. And what also happens around 6 months for a child is they start to explore, put things in their mouth. Yeah. And so, yes, you see your child putting a lot of things in their mouth. And so what actually causes teeth to erupt is that stimulation. Oh. And so them, putting things in their mouth and everything causes the tooth, also helps eruption of the tooth.
So do you know what we say? They are, what do we call it too? Kujikuna. It's like the gum is irritated, so they are trying to scratch.
So they're trying because the tooth is coming up, because it causes the gum to get itchy. And so what I'll tell some mothers is take a clean finger, and then maybe even let the child just chew on it. That helps with the itchiness, but also helps with stimulation of the gum. Or if you can, there's some teething toys that you can put in there, and that just also helps with the stimulation. Exactly.
When Wairimo was in utero, there's a time we did a scan and we found her sucking her thumb. So she's been suckling her thumb all through. So these are small habits that kids pick up maybe. So tell us what these habits, the habits that we should look out for, and how they damage the formula of the teeth, and what we should do about them.
A lot of parents, when they do the scan and they'll find the baby in the womb sucking the thumb, that's pretty normal because it's getting the baby prepared to breastfeed. So for the rooting and the sucking, because they're born with that reflex, the rooting and sucking reflex. So that's what it is when you see that on the scan. So we want to try and stop the habit by the time they're 6 months, because if they do it after that, it's a lot harder to stop, which you have discovered. And because what happens is it's a soothing mechanism for them. So you might find when they're upset, it calms them down. Or when they're sleepy, it calms them down. But if we can stop the habit before 6 months, that's what we want to do. Because what happens if they do it as their adult teeth start to come in, we start to see that it's changing the shape of their jaw, and then the teeth come in that position.
Like what we've seen with Wairimo actually.
Yes. So then now what we have to do is we're trying to stop the habit, different things like taping her thumb. Yeah. Also another good thing to do is if you can find a cartoon that they really enjoy, because they get lessons from these cartoons, and find one where maybe they talk about thumb sucking. And they may listen to this cartoon.
The cartoon is the influencer.
Yes, that's the influencer. That's where they get their lessons. Yeah. So that's a good way. Or songs, their children's songs about thumb sucking. But don't force them. If you see that you're forcing them, because they'll just pick up another habit.
Okay. Yes. So you don't advocate for put pili-pili, drastic.
So you can do that, but what you'll see is they'll just go to the sink and they'll wash it off. And if they keep on doing that, don't insist on doing it. Maybe try and talk to them, and then just try and talk to them and explain to them why it's not good, and then maybe have them go to their dentist, and their dentist may have other options or different things they can try out. But don't shame them, and you don't want to do that.
Okay, because we realized with Wairimo, it is much easier to talk, and it's bad, Dr. Njeri has said, but with Ethan, on the other hand, we tied the thumb, and he chose the other thumb.
Exactly. Yeah. So he'll just find something else. And if he's not, like Wairimo was ready, she was ready to stop, but Ethan's not quite ready, so let's not push him.
Okay.
Yeah.
So we take our time.
Let's take our time, and we'll find other ways to get him off the habit.
Okay, so there are other habits like teeth grinding and like me, I chew my nails. So how do they affect, and what?
When you're biting your nails, you can actually wear down your teeth.
Really?
Yes, because you're constantly now chewing on the nail, so that can wear down the teeth, and it also can affect the way the teeth grow in. Another thing with the grinding the teeth at night, it could indicate a more serious problem. And a lot of dentists think about sleep apnea. Their concern is the child able to breathe at night. So what we think is that the child is actually trying to posture, move the lower jaw forward to open up the airway. And so what I would say is maybe when they go to the pediatrician, have the pediatrician take a look and make sure the tonsils are not inflamed. We're finding nowadays a lot of children have allergies and tend to have larger tonsils, or their adenoids may be enlarged as well, or there are things in the nose called turbinates that also become enlarged, and that kind of compromises the airway. So at night when we sleep, everything tends to fall back. And so the airway may close a little bit, and so they're actually grinding to keep the mouth open, keep the airway open, so they can breathe.
So instead of opening their mouth,
they're grinding, yes,
okay.
to just kind of, because they sleep, so to posture, to move the jaw forward. So that could be an indication of that. If you find that your child is snoring at night, because your children should not be snoring, unless maybe if they're congested, because you know when you're congested, you can't breathe. So imagine when you're congested, you can't breathe through your nose, so you breathe through your mouth.
Yeah.
And so if your child is snoring a lot and you can hear them in another room and they're snoring or they're grinding and you can hear that, have a pediatrician just look at the back of the throat and make sure the airway is clear. Yes.
Because I remember even with Ethan, he used to snore so loudly, like I'm there, even in church.
Yes.
I go with him at around 6 months, 8 months. He'll snore, people will think it's Amze in the congregation who has slept.
And it's a small child.
Yes. So we realized he had adenoids, and at 1 year they were removed and everything went back to normal.
Yes.
So how can you stop teeth grinding? Can you stop it?
So that's if it's because they're not able to breathe, then it's because it's an underlying condition. So if it's like so maybe Ethan was just snoring, but some kids might actually be grinding as well. So if they go to the ENT or the pediatrician and then they recommend to remove them, that will eliminate that.
Is there any other habit that you would mention?
So mainly it's thumb sucking. It does affect the way the jaw grows and then the way the teeth look. Grinding will, if they're grinding, it will start to wear down the teeth, and then a lot of kids will chew on pencils and things like that. So those are habits we want to eliminate because those will also wear down the teeth.
So we've said for habits, you need to eliminate the habits before they start getting their adult teeth.
Yes.
Yeah, and the earlier the better. The earlier you notice, the better.
The earlier the better, because like I said, it does actually affect the way the jaw is growing. So we want the jaw to grow the way it should grow. A U shape as opposed to a V shape. Exactly.
Okay. So let's go to cleaning. This is World Oral Health Day, which is on March 20th. March 20th. Yes. So we need to also get the nitty-gritties of how do we clean our teeth, how do we clean our children's teeth. So movements, no one taught us. When we were starting to brush our teeth, it was just toothbrush, toothpaste, just run it around your mouth and move on with life. So is there a way you need to do it?
So now with infants, what I would recommend is if you can take a clean cloth and then just wrap it around your index finger and just gently rub the gums and any teeth that have erupted. So you're getting any food debris off those teeth, because it will be very difficult for an infant to use a toothbrush. So just kind of wipe the tongue and the roof of the mouth with your cloth. With the index finger and the cloth.
Okay.
Then as they get older, you want to get a toothbrush. Always make sure it has soft bristles, and then you just brush around you want to make sure you get by the gum line, because that's where a lot of the plaque will build up. So I have Mr. Crocodile, who's my helper today. And so what happens is when we tend to brush our teeth, we tend to only brush the teeth, okay? But we tend to miss by the gum line, and that's where the plaque will build up. So if you can angle the toothbrush like a 45-degree angle and get at that junction of the gums and the teeth. So with children, you can just brush like that, okay, and go all the way around. And then you also want to get the chewing surfaces. But we always tend to forget the tongue side.
Yeah.
Okay.
Even me as an adult, I always forget.
So what you want to do is angle the toothbrush, and again, make sure you're getting by that gum line, and again, working the way around. Then when you get to the front, that's how you'll angle the toothbrush and get back there.
So always at an angle, not like this, like
at an angle, because you're trying to get at this junction. Yes. So if at the inside, you're trying to get at the junction of the gum and the tooth, because that's where that plaque will build up. Always remember to brush the tongue and then the roof of the mouth. Yes. Okay. Thank you, Mr. Crocodile.
So you also need to get age specific. Nowadays, the toothbrushes come with age specific.
Yes.
And age-specific toothpaste as well.
So you always want to make sure the toothbrush is small enough so it fits in the child's mouth. So you don't want a big adult toothbrush because it won't be very effective. And then also, especially young children, you want to avoid fluoride, because fluoride, they tend to ingest it, they swallow it, and the fluoride can upset the stomach. So you always want to get fluoride-free toothpaste, and you really want so little, just like a smear. And then, or you can, and especially like infants, don't use any toothpaste.
Because they'll just end up swallowing.
They'll just swallow it. Just use water and just clean. As they get older, just a smear and use that. With toothpaste, I'd recommend use toothpaste when you know that they can spit it out.
Okay.
If they're not able to spit it out, don't use the toothpaste.